name is Christina Jackson. I'm a nursing student at Lincoln Tech. Today is October 29th, and I'm going to be doing a video demonstrating IM injections, subcutaneous injections, putting on PPE in the correct order, sterile gloving, and a glucometer reading. So to begin, I'm going to make sure that I have all the materials that I'll need for the procedures. First, I'll be giving injections. So I have subcutaneous, I have IM, I have my patient, which will be where I'll be injecting my injections. I have my PPE, a gown and a mask, and I have gloves. I have sterile gloves for when I get there. And I have a glucometer reading, glucometer and the test strip to apply it. And for the needle that you use to take the blood for the glucometer, I'll use my pen. And then I have alcohol wipes to clean my sites. So I'll use that for my injections and that for my glucometer reading. So before I go in and see my patient, I'm going to wash my hands, okay? So I'm just gonna demonstrate washing my hands in this video. I would wash them with warm water for 15 seconds, and then after my 15 seconds, I would take a clean paper towel and turn the sink off. And then I would grab more clean paper towel and tap my hands dry. After that, I'll walk in my patient's room, knock, 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 shut the door behind me, providing privacy, and I'll identify my patient. So, hi, I'm here today to do some procedures on you. I'll be giving 2 injections. I'll be taking your blood sugar. And okay, so to get started, I'll identify my patient using 2 patient identifiers. So what is your name and your date of birth?
Joe Bob.
And your date of birth?
July 15th, 1980.
Great, so my files say the same thing. So I have the right patient and I'm able to get started on my procedure. So first I'm gonna apply my PPE, and in the order that I would apply it is my gown, my mask, and then my gloves. So here goes nothing. This gown was used a couple times by me, so that's why it's out of order. Obviously for a real procedure, make sure you have a clean gown, clean everything. Mask. And you want to make sure your hair is up and pulled back, not in your face, not where it can be contaminated. Gloves. These are just clean gloves, they're not sterile. Rain is pouring out there. All right. So now that I'm all protected, I have everything I need, I'm going to explain to the patient one more time what I'm going to be doing. I'm going to be giving you first an IM injection, and I'm going to be giving that into either your deltoid, your vastus lateralis, which is your thigh, your ventral gluteal, which is your hip, or your dorsal gluteal, which is your buttocks. The needle lengths that I'll be using are a 1 to 1.5 inch needle, and I'll be using a 22 to 23 gauge. And then IM injections are given at a 90-degree angle. So before I begin giving his injection, I'm going to clean the site with an alcohol wipe. Let it dry for a second. And then I will uncap my needle. I'm holding it in my dominant hand because that's the hand that I'm best with, that's the hand I'll be using. And I'm gonna push the skin back a little bit, and for IM, you do wanna pull back and aspirate a little bit to make sure you're in the right area. So I'm going in at a 90-degree angle for this. So in, holding it with my non-dominant hand, and I'm pulling back, aspirating just a little bit. It's great, I got a little blood back, so I'm in the right area. I'll inject, I'll pull out, cap my needle, and toss it into my sharps. I'm sorry, this mask is it's been used a lot, so it keeps falling off. In the real world, you don't want to touch your face, you don't want to touch your mask. Make sure you have the appropriate fitting stuff before you even enter your patient's room. So now that I've given him that injection, I will cover it, I'll make sure everything's great with it, and if everything is great, I'll move on to my next injection, which will be my subcutaneous. So once again, I'll find the site where I'm going to be doing it, and the sites that we use for subcutaneous are the abdomen, the thigh, the lower back, or the upper arms. And then I'm gonna be using the abdomen near the belly button, so I'm gonna go 2 inches below the belly button. So once again, you clean your site. So for subcutaneous injections, we use a 1 to 3 millimeter syringe. We use we can use 5/8 or 1/2 for insulin. You want to use a 23 to 25 gauge, and you want to go in at a 45-degree angle. So uncap your needle when you're ready to inject. Pull back on your thing. Make sure you have your medicine in, and then for subcutaneous, you want to inject into the fat. So I'm just gonna push up the skin just a little bit. I'm pushing it together to like bundle the fat. So I'm just gonna go in at my 45-degree angle, quickly inject, quickly pull out, cap it, toss it into my sharps. At this point, I would change my gloves. So those gloves are done, they're in the trash. Now, Joe Schmo, I'm gonna be checking your blood sugar. So after I apply my fresh gloves, I am going to tell him what I'm doing once again. So Joe Schmo, now I'm gonna be checking your blood sugar for the doctor, okay? Because your doctor ordered all of these tests, so moving on. I'm gonna use my my prick, my little needle, and he got it yesterday in his left finger, so today I'm gonna go to the right finger because I don't wanna keep injecting on the same finger, okay? So once again, before doing anything, you always wanna clean your site. Cleaning it. Great, it's clean. I'm gonna let it dry. I'm gonna take my needle and I'm gonna get like the outer edge of his finger. So this is his finger. So I pricked him, I got his finger, blood is coming out. Now with a gauze, clean gauze, you wanna wipe away the first speck of blood. And then let the next blood come out, and don't milk it, don't do anything abnormal like that. For me, as the blood is coming out in the second, I like to put the test strip in at that point. So my test strip is connected to my glucometer. My glucometer is on and working. And I'm just gonna pull it right up to his finger and let the blood slide right on there. I'm not gonna scrape it, I'm not gonna milk, I'm not gonna do anything like that. So glucometer is reading, his blood sugar is 120, so that's really good for him. So Joe Schmo, your blood sugar is 120 right now, that's great. I'm gonna let your doctor know that, and wonderful. Is there anything else I can do for you, Joe Schmo? No, I'm good, so we're good. So now that he's done with his injections and his glucometer reading, I'm going to practice putting on sterile gloving. So I'm gonna take off my gloves, toss them. Now, this is my sterile field, everything is clean here. I'm going to open the package away from me. I will toss my gloves down, great. And then you wanna open the package. You only can touch the sides and the outer area of the package. So scooping underneath to open it up. It's open. With my dominant hand, I'm gonna put on my first glove. So just slide in there kind of. I don't wanna touch the outside at all. I'm still just touching the inside too. Free the thumb. Okay, thumb is good. Glove is on. Now with my dominant hand, I'm gonna pick up my left glove. And for this one, you wanna make sure you don't touch the outside. Just slide your hand in there, holding that little pocket, and hold it, pull it back. Sterile gloves are on, I'm good. Keep my hands above, don't go below, don't turn my face on the sterile field. Blah, 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 blah. So, now that I'm done with all my procedures, my glucometer is still here, my needles are in the sharps, the rest is trash, the patient is there, he's good. So now I'm wearing PPE, so I don't want to contaminate anything. I don't want to take that glucometer out just yet. So I'm going to leave my glucometer here. And then I'm going to take off my protective clothing. So that's gloves, mask, then gown. So taking off my gloves. Gloves are in the trash. I'm going to take off my mask now. Mask is off, mask is in the trash. And next I'm going to take off my gown. Now you can reach behind you because they say that it's not contaminated in the back. So you can untie your gown. I just flipped it over my head because I tied it, but I would rip it right off in real life. So now that my gown is off, you just kind of want to roll it right up. Roll it right up and toss it out in the trash. After that, you want to go and wash your hands vigorously again, warm water, 15 seconds. Paper towel to turn off the sink. Pat your hands dry. I would then again walk back. I would glove up once more. I would take Sani wipes, like the really strong ones, and I would come and I would clean my glucometer up with those wipes, so that way it's not contaminated, and I can take that out with me because I'm wearing clean gloves at this point. My PPE is thrown away. So that's how I would demonstrate these procedures. Thank you for watching. Goodbye.